How do you know that you have estrogen dominance? Well, this is such a great question because I do believe that there are many women with hormonal imbalances that actually have estrogen dominance. And what is estrogen dominance? It's basically excess amount of estrogen in the body in ratio to progesterone. But unfortunately, there's not enough information and education out there to bring awareness to this. So this is why I created the Estrogen Reset course. And if you're wondering, do I have estrogen dominance, and if this course is for me, I'm going to provide you with the 5 different signs of estrogen dominance, so that way this can help determine if this course is for you. The first sign is irregular periods. So when women have hormonal imbalances, they typically tend to have irregular periods. So they're not having a period at the same time every month. And most of the time we think of polycystic ovarian syndrome, or PCOS, which is linked with these irregular periods. And with PCOS, it's typically high androgens, such as testosterone or DHEA. But what women don't realize is that there's also an excess of estrogen that is occurring in the body as well. So with PCOS, the main outcome is to lower those androgens, but the estrogens are not getting addressed, which is why a lot of women with PCOS are not getting better. The second sign is heavy bleeding. So as our body goes through the cycle, right before ovulation, the uterus is getting prepared for pregnancy. Estrogen starts spiking because they're not only maturing the egg, but they're responsible for thickening the lining of the uterus, which is called the endometrium. After ovulation, progesterone starts to increase, but if the egg is not fertilized, pregnancy does not occur, and the estrogens start declining with progesterone. Now with estrogen dominance, there typically is higher levels of progesterone, so the lining of the uterus is getting thicker than normal. So once those hormones start to decline back to baseline, and the body, and then you start having your period, so you start shedding that endometrial lining, this is what is going to contribute to a heavier bleed. The third sign is PMS symptoms. So a lot of women that are experiencing severe debilitating cramps, headaches, mood swings, breast tenderness, this is not normal. And this is a sign of hormonal imbalance in the body. But women don't know what hormone is out of balance. And typically it is due to these excess estrogens, and sometimes due to low progesterone as well. So for example, the cramping, when women experience cramping, the body is releasing a chemical called prostaglandin, which actually increases inflammation and pain. But when there's excess estrogen in the body is producing even more prostaglandins, which is why women are experiencing these painful menstrual cramps. Also, the mood swings are due to these fluctuation of hormones. So if there's excess estrogen and lower levels of progesterone, women are experiencing anxiety and depression. Why? Because progesterone is our feel-good hormone. It's our feel-good, happy hormone. And if there's lower levels, especially compared to the estrogen, this is creating an estrogen dominance effect in those mood swings. And then high estrogens have also been linked to migraines. The fluctuation of these hormones and low levels of progesterone contribute to headaches and migraines. And then the fourth sign is breast tenderness, which is part of the PMS symptoms, but even more so, because excess estrogen in the body is actually what causes the breast tissue to swell. So estrogen and progesterone are responsible for the development of breasts as we go through puberty, but when we cycle every month, if there's an excess of estrogen in the body, it causes the breast tissue to swell, which is why it's painful. And then there are women that actually develop cysts. They are diagnosed with fibrocystic breast disease, and that's due to excess estrogen. So breast tenderness from those excess estrogen is another sign of estrogen dominance. And then the fifth sign of estrogen dominance is weight gain. So if you are gaining weight, think of where in the body are you gaining that weight. If women are gaining weight in the abdomen, this is actually a sign linked with metabolic imbalances and excess cortisol, so issues with adrenals. But if women are gaining weight in the butt, hips, and thighs, this is definitely a telltale sign of estrogen dominance. Now, there are some women that actually have weight gain all over, but this just means that there could be balances with everything. metabolic imbalance, adrenal imbalance, and hormonal imbalance as well. But like I said, the most common telltale sign of estrogen dominance is that weight gain in the butt, hips, and thighs. So those are the 5 top signs of estrogen dominance. And if you are experiencing 2 or more of these symptoms, you most likely have estrogen dominance. Now, the only way to know for sure is to get testing through a functional medicine practitioner to look at your hormones more in depth to see where those imbalances are. But like I said, those are the most common signs, and I recommend checking out the Estrogen Reset course to learn more about estrogen dominance, all the lifestyle factors, things that you can do to start implementing in your daily routine to help balance out those estrogens. Other than that, if you have any questions, let me know. Live with intention and be radiant.